We're here right now in the current ward that treats children with blood diseases and disorders like thalassemia and sickle cell disease, as well as children with cancer such as leukemias and brain tumors. This is the current ward right now that treats them, and as you can see here, there are about 6 or 7 beds in a single room. These children who need so much different care, different aspects like psychosocial care, different drugs that we have shortages of, equipment that isn't available for their diagnosis right now. Most of the children in this room have left the Gaza Strip at some point just to receive different diagnostic tests and medications that aren't available here. We have with us here, شو اسمك؟ بتول is عمرك كم سنة؟ 5 سنين, 5 years old. Batul has Wilms tumor, which is a type of kidney cancer that occurs in children, typically in age 5. Batul has already had to leave the Gaza Strip 2 times and is awaiting a permit to leave a 3rd time. She had to leave once for surgery, she had to leave a 2nd time for a different treatment, and now for a 3rd time because of a drug shortage, a very common chemotherapy that can't be found in the Gaza Strip due to frequent drug shortages. She's having to leave yet again without her family, leaving them here behind just so that she can receive this medication and come back. They're going to go on a long trip just because this isn't available, and our hope is to be able to have all of these drugs available in a new facility so that she doesn't have to leave her family behind. Really is to be able to build a department upstairs, just 1 floor above the current one in this Pediatric Specialized Hospital, that will have all of the facilities that are needed for these children who need help, the different medications that they need, the different testing that they need, space that's clean and hygienic and allows for a lack of infections and control from that, different psychosocial aspects of care like a beautiful new playroom so that they can have entertainment and good psychosocial care during their long stays here in the hospital with their families. We're up here in the middle of the construction of what's soon to be the new Dr. Musa and Suhaila Nasir Pediatric Cancer Department, the first and only public pediatric department for children with cancer and blood diseases in the Gaza Strip. Our hope is that when this is complete in just the next few or several months, that we'll have a beautiful department consisting of 16 inpatient beds, 12 infusion or day hospital beds, and several clinic rooms as well. A beautiful playroom to help with the mental health of our children who are going through extenuous treatment from 6 months up to 2 or 3 years or even longer, as well as training center and medical libraries and other facilities for the physicians so that they are the most up-to-date and current. When this is complete, we're going to have really a beautiful department that is completely state-of-the-art and should have all of the facilities and resources available for children in the Gaza Strip so that hopefully we can really decrease referrals and kids can stay here with their families for their treatment.